Language disorders are disorders that involve the processing of linguistic information. They can affect both spoken and written language. The neuroscientific understanding of language disorders is increasing every day to help understand, diagnose, and treat language disorders, such as stuttering and apraxia. So, what is stuttering? Stuttering is a speech disorder characterized by disruptions in speech motor behavior that result in sound and syllable repetitions, audible and inaudible sound prolongations, and broken words. Whereas apraxia is a severe and persistent pediatric speech sound disorder where the precision and consistency of speech movement are impaired. Comparing stuttering. Stuttering develops in children from ages 2 to 4, but most children grow out of it. The scientific article, which we shall call Article A, a review of brain circuitries involved in stuttering, discovered a link between chromosome 18 to stuttering, as well as mutations in lysosomal metabolism gene and white matter abnormalities. Functional and structural abnormalities display that stuttering is a basal ganglia disorder which aligns with neuroimaging studies. Article B studied and fluent speech production, an ALE meta-analysis of functional neuroimaging studies, also highlighted the structural abnormalities in the left hemisphere in the superior temporal gyrus and agreed that the basal ganglia was one of the major factors in the case of stuttering. But Article B focuses the scientific knowledge on chronic developmental stuttering, classification of neuroimaging, and the 3 neural signatures of stuttering. Whereas Article C, disrupted white matter in language and motor tracts in developmental stuttering, looks into symptoms of stuttering and examines the white matter tracts of areas involved in speech and motor control. The study also found that an incomplete cerebral dominance altered basal ganglia activity and motor speech abnormalities in stuttering, which aligns with the research from both Articles A and B. Comparing apraxia. Article D, diagnosis and understanding of apraxia of speech, why including neurodegenerative etiologies may be important, was the first scientific research to discuss possible correlation between stroke-induced apraxia of speech, AOS, and progressive apraxia of speech, PAOS, but found that a part of stroke-induced and progressive apraxia of speech both affect older patients. They differ since PAOS does not follow a vascular distribution, the brunt of cortical pathology in the premotor and supplementary motor area, and its onset is slowly progressive, unlike stroke-induced AOS. The scientific article E, Neuroanatomical Correlates of Childhood Apraxia of Speech, a connectamic approach, concluded that children with apraxia perform below age expectation due to a reduction of fractional anistropy, FA, in 3 intrahemispheric interhemispheric subnetworks. The reduced FA of some of the connections correlated with diakokinesis, a measure of speech dysfunction, also correlated with limited motor skills. Article F, Review of Motor-Based Intervention Protocols in Treatment of Childhood Apraxia of Speech, outlined Schreiberg's Speech Disorders Classification, SDCS, which is the first attempt to categorize speech sound disorders by etiology, which focuses attention on the various subtypes of speech sound disorders, SDD, and difference in speech onset rather classifying them by descriptive linguistic typologies. It outlined that CAS is associated with speech motor preparation and treatment can improve their speech motor such as target selection, integral simulation, and rapid syllable transition. The Article F outlines that further research is needed to achieve maximal improvement for childhood apraxia of speech, but also notes that technology and knowledge is rapidly improving and has now facilitated in treatment for individuals who have language disorders such as stuttering and apraxia. Technology provides evidence-based information and practice to both patients and speech pathologists. Technology in treatment. Stuttering. Electronic clinical aids are the most important equipment for day-to-day clinical practice. With the improvement of technology, these can now be incorporated in mobile devices, allowing for daily use and therefore better and easier diagnosis and tracking of the disorder. New software tools such as Stuttering Measurement System help measure and identify the syllables stuttered and help measure speech naturalness. Altered auditory feedback devices are also available. These devices involve electronic shifting of frequency or pitch of the individual's speech and alters it back to the speaker. For stutters and their families, blogs and chat rooms are available easy and free exchange of information and ideas about different and unknown aspects of stuttering from around the world. However, these can become problematic due to the distribution of biased opinions and/or false assumptions of treatments. Technology in treatment for apraxia. Blogs and chat rooms can also be used for apraxia sufferers and their families. Most patients of apraxia of speech (AOS) recover speech abilities without help, except for children, which cannot outgrow the problem, therefore require speech therapy. There is a variety of approaches for treatments, but no approach has been proven to be effective for all patients. To improve speech motor in children with apraxia, the most effective treatment is to extensively use motor-based intervention protocols. Other approaches that are effective in treating apraxia in children are target selection, integral simulation, rapid syllable transition, physical restructuring, oral muscular phonetic targets, biofeedback treatment, and Nuffield dyspraxia program. In conclusion, the neuroscientific understanding of language disorders is constantly increasing as technology develops. Scientists learn more about what the causes of studying an apraxia of speech are and how these have developed new categorization of apraxia basis of their causes, which has led to new treatment approaches. Even though both disorders have many effective treatments, a treatment that works for all patients is needed.